Hey, I'm Dr. Ballard, and I'm going to talk briefly right now about how you make the decision from a symptom standpoint to go forward with having your hip or your knee replaced. Making the decision to go forward with getting your hip or knee replaced is very subjective and very individual. Unlike a lot of other decisions in healthcare that might be based off a specific test or a specific score, this is something that is based off of the individual's needs and how the individual is experiencing their arthritic condition. So what are the symptoms that typically lead people to make the decision to have their hip or knee replaced? There really are two. One is pain and the other one is instability. So when pain raises to a level that it begins to limit your life in a way that's significant to you, maybe it's taking away recreational activities, maybe it's making day-to-day activities painful, maybe it's hard for you to sleep, etc. When it reaches that level, that's when you start making that decision. One thing about the pain from arthritis is that the pain and the impact it has is known only to the patient. It starts to become something that impacts every aspect of your life. When it begins to get like that, it's time to consider having your hip or knee replaced. The other element that can be a strong factor in making this decision is, does your arthritic knee or hip make you unstable, prone to falling, or uncomfortable or not confident in your ability to get around? When that starts to become a problem, it's also time to consider having your hip or knee replaced.